My name is Terri Suresh. I'm a nurse practitioner, and I have a wellness center in Southlake, Texas, and in Rockwall, Texas, called Hormonal Health and Wellness. I'm also the national spokesperson for BioTe Medical, and my passion is really educating men and women across the country, really, and physicians, new physicians or practitioners that want to learn how to integrate this therapy into their practice on the necessity of hormone balance and why is it so important for not only your physical well-being and where you are today, but long-term benefits and long-term prevention of disease. So let's talk about hormone balance. Why talk about hormone balance? Well, hormone balance is very important because a lot of patients find themselves, or a lot of people find themselves kind of like this throughout the day. You know, they're just kind of not focused, they don't feel good, they haven't slept the night before, they're really stressed. The normal little things in life that really kind of shouldn't really bother us are just really grating on us, really moody and irritable, and all of those symptoms really keep us from being fully productive in life and fully present in life. And I love this term called presenteeism. And presenteeism is a concept that you're physically present but you're mentally absent, right? And a lot of business owners are realizing that presenteeism is costing their businesses more than absenteeism. So it's more expensive for people to have employees that are physically there and not really getting a lot of work done than if they would have called in sick. So it's a really important concept to understand. The hormone balance gives you the ability to be fully present each and every day in all aspects of your life. And I say creating wealth in all aspects of your life. We're often think of wealth as money wealth, but it's really more than just financial wealth. It's emotional wealth, physical wealth, spiritual wealth, relationship health, and so forth and so on. So that's why it's important, and that's why we're going to talk about it today. So how do you feel? This is how most of our patients come in initially to our offices across the country. They're depressed, they're moody, they're anxious, they're irritable, they're tired all the time, they're not sleeping at night. They're hitting a wall at about 2 to 4 o'clock in the afternoon and looking for Starbucks or some kind of Red Bull or something to kind of get through the day. PMS is horrible for women in this premenopausal time. Their symptoms of PMS are exacerbated way greater than they were when they were younger. Women have a decreased sex drive and libido. They really couldn't care less about sex drive. Men have a decreased sexual function, although they still care about it. Men rarely lose libido as their testosterone levels fall, but women definitely lose libido, and it really is an important part of relationships, right? So it's that relationship health. So, sounding familiar, we can't lose weight, we're not sleeping, we're fighting with our significant others, we're fighting with our family members. All of these things tie back into hormone balance and the ability to be fully present. So what's the answer to all of these symptoms? Depression, anxiety, irritability, mood swings, brain fog, can't focus, can't sleep at night. When you go to your doctors, what is their answer? Anybody? Chime in. This is interactive.
Medication.
Right, medications, right? Antidepressants, sleeping pills, anxiety pills. My new favorite, adult ADD, Concerta, you know, I spoke on it a little bit yesterday. We're not Concerta deficient, we're not Prozac deficient, right? We're not Xanax deficient, we're deficient in hormones. So the mainstay of medical treatment for all of these horrible symptoms is to band-aid the symptoms with drugs, and it doesn't work. What we really need is to find the root cause, and 90% of the time the root cause is hormone balance, thyroid optimization. You know, thyroid numbers look good on labs, and we'll talk a little bit about that in a minute, but you're really symptomatic for low thyroid. Certain nutrients like iodine, vitamin D, they all play a big role in our hormone balance. So natural hormone balance is an alternative to bad medicine. It's not alternative medicine. And this is kind of some languaging that I'm trying to teach not only physicians and practitioners that come train with us, but just the general population, because there's this voodoo thing around alternative medicine. Oh, that's just alternative medicine is, you know, what are you, granola, and you don't shave your armpits and all this kind of stuff, right? I mean, it's kind of got this like mentality around it, but it's really not true. All of that means is it's an alternative to bad medicine. And when we say bad medicine, we mean throwing drugs at you to treat symptoms and band-aid symptoms and not fix the cause. Okay, so I don't want to send the wrong message. I don't want you to think that all prescription medications are bad, because some of them are very necessary and life-changing, but by and large, there's so many things that we're prescribing to patients that aren't fixing the problem. Estrogen and testosterone. So when we think about hormones, most people think of estrogen first, right? When you say hormones, that's the first thing that comes to mind. And estrogen is a very important hormone. It's a woman's most important hormone. It has over 400 functions in the body, for everything from maintaining collagen in the skin to bone density to vaginal and bladder health, colon cancer risk reduction. Estrogen plays a huge role in the gut. And bone density, not as much as testosterone, but it does play a role in building bone, preventing osteoporosis. Tons of amazing benefits for natural estrogen. But testosterone is the hormone. This is the biggest myth that I like to dispel when I have these kinds of talks, is to really educate people that testosterone is the primary hormone, not just for men, but for women. And this is very surprising to a lot of women. They don't know, oh, I didn't know I made testosterone. Well, yes, the inner core of female ovaries makes testosterone. The outer core makes estrogen. As a woman ages, her ovaries kind of age from the inside out. So we lose testosterone many, 10, 20, 30 years before estrogen declines. So testosterone goes first. And like I said before, that is the brain hormone: depression, anxiety, irritability, mood swings, brain fog. How many of you in here have had 2 or more children? Never bounced back after that second one, right? No. Right, it's true. First one, you bounce back, you can kind of drop the weight, you still have the sex drive, your energy is still pretty good, considering that you have a young one. But that second one, you never bounce back. And the second pregnancy, by and large, really is kind of what shuts down that testosterone. It's really an interesting phenomenon. No studies really showing that. That's just my observational study. I also have a really big theory that I'm going to prove one day and do a study on, that postpartum depression is a disease of low testosterone. And I've treated postpartum depression with pellets very successfully, many times in the practice. It doesn't cross over the breast milk, so it's very safe for postpartum women to have testosterone pellets, and they feel really good. So besides providing major symptom relief from all of those symptoms that we talked about, testosterone protects the bones, the brain, the breasts, we'll talk about that in a little bit, the heart, the joints, and most importantly, relationships. And I have a little story to tell. This is a patient of mine who's now, their whole family is our patients of mine. They have great Christmas every year because everybody's hormonally balanced. It's awesome. But started with this patient's daughter and son were seeing me, and their mom had been pretty miserable for many years. And so they come into my office and sit down, and I go in, and somehow the conversation led to her husband that was sitting next to her and what he did for a living. I don't know how we got on that conversation, but it was early in my practice, and I had a lot more time to sit and chat with my patients. And so I found out that he was a retired OB-GYN. So instantly in my mind, I thought, oh, great, I'm about to get the Spanish Inquisition here. I'm about to get really railed. But he didn't. He was very respectful. He listened to what I had to say. And they decided to move forward with his wife, he was 83 and she's 20 years younger, with the therapy for her. And so I thought, well, great, he's trusting me, I'm giving him good information, that's good. So she comes back for her follow-up blood work, because we do follow-up blood work on all of our patients after their first round of pellets to make sure we dose them properly. And she's sitting in the lab chair, and she sees me, and I wave at her, and I come say, hey, how are you doing? She starts bawling. I thought, oh, I screwed something up, she's not balanced. And she said, no, I just want to tell you this. She said, I have not liked my husband for 25 years. And she goes, and I realize now it was me and not him. And I feel like I've lost all this time because he's in his 80s now. And then she kind of got it together and she said, you have really given me my life back, and I will never stop this therapy. And I just hugged her, and I was just like, oh, that gives me chills saying the story now, because those are the things that keep us going every day, when you can provide that much life change. Well, 2 weeks later, I go into my next patient, and there he sits as a patient. I thought, oh, okay. And he said, he's from South America. He says, let me tell you something. He has this great accent. So he's 83, and I'm going, oh, because the accent just is so great. And he said, had I known about this therapy when I was a practicing OB-GYN, based on what I've seen in my wife, I would have every one of my patients on this therapy. And she said, he said, and now I can't keep up with her, so I need to get this done too. So he's now 87, and he just swam across, I can't remember what channel it was, with his sons in South America, and they're just great. And their whole family now is pelleted. So I say that because we see time and time and time again, when women especially, men too, I mean, men get cranky and irritable and moody and all that stuff when their testosterone is low, but really women, it affects us to a greater degree because we have less reserve to draw from, really, right? And we're also dealing with estrogen and all kinds of other stuff. But it really is so profound for relationship health. When we're moody and women don't want to have sex and, we're yanking all the time, it's not good for relationships, right? So it's really profound for relationships, and we've had husband after husband. I had one guy say, we will eat ramen noodles in our house before she stops this therapy. Right? Because everybody, you gave me my wife back, you gave me my mother back. So don't discount how important this is for relationships. So we'll move on to the next slide. Yes, women make 300 about milligrams of testosterone per day with healthy ovaries. And so it's really important. I love this slide. It ain't what you don't know that gets you into trouble. It's what you know for sure that just ain't so, right? So now I'm going to dispel some myths about hormone replacement therapy. And every drug that has been recalled by the FDA was first proven to be safe and effective by the FDA. And I say that because every time I do this talk, somebody in the audience says, is it FDA approved? I won't belabor and get on my soapbox about FDA approval. However, the pre-answer to that question is yes, natural testosterone and estradiol that is used in the pellets and in any form of bioidentical hormone replacement is FDA approved. Testosterone is a Schedule II drug. It is highly controlled by the FDA. The actual pellet implant procedure has not gone through FDA approval, nor do we want it to. Because what does that mean? Cost, regulation, all this crazy stuff. I mean, we've been doing this pellet therapy since the 30s, before the FDA was even a blip on anybody's radar, right? So just to, if you get that question, or that question is in your mind, or you hear that question come up, this is a really good answer. The first drug I'm going to talk about that has wreaked much havoc, not only on women with hormone therapy, but the whole reputation in general of hormones. Unfortunately, in this country, the media has lumped all hormones under one umbrella. Bad, right? We don't need them, they're going to kill you. Really? Because how many 20-year-old women are dying of breast cancer and osteoporosis and blood clots and all these things? They're not. So it's a bad message, and one of the biggest things I want to dispel and tease out for you today is the differences between bioidentical and synthetic. But first of all, this horse is about to get a big injection of some human estrogen, and she is not happy about it. However, millions of women every day take oral progestins that are created from the urine of pregnant mares, and it doesn't work well. It's a Band-Aid. It's not balancing hormones. Premarin, Prempro, and it comes under so many names now because Premarin and Prempro got the little bash with the Women's Health Initiative trial. The Women's Health Initiative trial in 2002 really messed things up for women in this country. This trial was over 10,000 women in it, and it was actually halted early due to overwhelming evidence that hormones cause an increased risk of breast cancer, strokes, heart disease, Alzheimer's, dementia, blood clots, and so forth, and they're bad, and everybody taking hormones should throw them away and never take them again. So women were flushing them. Doctors quit prescribing them. And in about 3 to 6 weeks, when those blood levels were coming down, these women were suicidal or homicidal and begging for their hormones back because they were like, I don't care if I get breast cancer, I cannot live like this. So, because it was doing a good job of band-aiding their symptoms, right? So the message that should have come out of that study, and it's being repeated right now, and I'm kind of scared to see what they come up with this time, but it is being repeated. The message should have been, we need to take a closer look at hormones, especially synthetic hormones. Maybe we need to look at the doses we're giving, the type of delivery, Is it safe for all people? There's a lot of questions that should have been asked instead of just saying they're bad, because hormones are not bad. Patches, way better than oral, because oral progestins, and when I say progestins, that just means synthetic estrogens and progesterone. When they metabolize through the liver, that's what really unleashes all these untoward side effects. And I like to compare and differentiate bioidentical hormones and synthetic hormones like a lock and key analogy. The receptors all over our body can be considered the lock, and the hormone the key. So bioidentical hormones fit in the lock and turn the lock and unleash all the wonderful effects, and it works great. Very minimal side effects when dosed correctly. Synthetic hormones, the key fits in the lock but doesn't really turn it. So it band-aids some symptoms, but it unleashes many untoward side effects that we don't want. And taking those orally exponentially increases those side effects and risks. So patches are better. Patches going through the skin are much better than taking something oral. Estradiol patches, Vivel-Dot, now they come in all kinds of different doses, and well, not doses, there's only 2 or 3 doses, but names is what I meant to say. But the problem with transdermal, meaning across the skin, is 45% of people don't even absorb hormone through the skin, and so they're really not getting what they need anyway, even if it is natural estradiol. Okay? So better, less side effects, less water retention, less weight gain than orals, but still not the best. Creams were the mainstay of my practice before I started losing my patients to this wacky doctor in Arlington that was doing pellets. You may have heard of him, Gary Donovitz. We had several mutual patients, and I had, I kind of had a couple of hundred patients with the creams, and every convention for creams I went to, no one could ever answer this question for me. How do we dose it? What am I supposed to do this saliva testing? Well, you just try a little bit. If they don't feel better, try a little bit more. Rub it here, maybe here, whatever. And then see. No one was talking about testosterone in any of these conventions. It was really interesting. Although the A4M last year in 2013 or 2012 really started hitting on testosterone for women, which I was very excited about. So creams and gels have a lot of problems. Number one, again, it's cookie cutter dosed. Everybody kind of starts with the same. Unfortunately, the compounders put progesterone in everything, and not everybody, progesterone causes weight gain, a lot of side effects. Moreover, it really doesn't keep you balanced. And again, it goes back to that point that 45% of people don't even have receptors to absorb hormone through the skin. So cream's not the best alternative, especially for premenopausal women who really need testosterone and not biased cream. Testum cream, this is a great slide because a lot of men will go to their practitioners and at least convince them that they need some sort of testosterone. Testum cream, androgel cream, it's an easy script to write. But this was a great study because it showed, so first of all, I just want to tell you, the optimal level for testosterone in a male used to say 800, but now we say 900 to 1200 based on a lot of information that came out of A4M last year. So 900 to 1200 is really the best, where men feel the best. For women, that's between 80 and 130 is what the literature says and what we teach our doctors, but we found most women feel the best between 100 and 200, somewhere in there. Some higher, like me. I like running on high octane. But what this study showed is that over time, these males that came in, about 300 of them, started with a testosterone level of 250, and creams only got their levels up about 100 to 200 points max. So the best they got to was 450. Well, men get symptomatic for low testosterone when their levels fall below 600. They start to get the brain fog and those kinds of things. And as male testosterone levels fall closer to 300, 200, 100, that's when they're really moody and anxious and irritable, and they're starting to get that belly around the middle, because when your testosterone levels fall, cortisol levels go up, which increase belly fat, increase type 2 diabetes risk. So there's a lot of prevention with having your testosterone levels up for males above 900. So creams don't really work. Anybody smelled Testum cream before? You wouldn't even want to even remotely sit next to a man that uses Testum cream, much less have sex with a man that uses Testum cream. So it's kind of doesn't even really make a whole lot of sense. what we found, and I don't have the slide in here, I need to get it in here, but what we found at some most recent research last year at A4M was that for every 100 points a male testosterone falls below 900, his risk for all-cause mortality goes up. So everything that causes death in a man, every 100 points, so 800, 700, 600, 500, 400, and so forth. So heart disease, strokes, Alzheimer's, dementia, prostate cancer, anything that men die from, his risk goes up for every 100 points he falls below 900. So our goal with the BioTe method is really to get those levels up 900 to 1100. Anything much higher than that, 13, 1400, guys, don't feel good. It doesn't feel good. So more is not better. It's all about balance, and it's balancing the estrogen and so forth. Injectable testosterone, no good. Why? Because when it wears off, they get so cranky, so cranky. What happens with injectable testosterone, besides 99% of them are synthetic, it's in a cottonseed oil base, so when you inject the muscle, the absorption is very variable. They can get a great response one time and the next week get a terrible response. And so a synthetic testosterone actually has many untoward side effects, long-term risk, which is totally opposite of what we want. It increases liver issues, coronary artery disease, prostate cancer risk because of the synthetic nature. So again, not all hormone therapies are created equal. But the biggest problem that guys have with this stuff is, you know, they give themselves a shot, and by day 2 to 3, they're feeling pretty good. By day 4 to 5, they're crashing, and they can't get another shot for another 4, 5, 7 days, depending on what their prescription is. And so they're on this huge roller coaster. And if any of you have ever been around a guy when his testosterone shot wears off, they are not fun. This is what you get. They're irritable. They're very, very irritable. And that's no good. We'd rather have them none. Of course, hormone pellets are my favorite mainstay of hormone balancing. And the reason is really threefold. 3 reasons why I love pellets. Number 1, the dosing is highly specific to the patient. We dose the hormone pellets based on parameters of your age, your weight, your blood levels, your activity levels. And here's a good thing. We retest you 4 to 6 weeks after to see how you responded and tweak it if you need it. No other hormone therapy does that. No other hormone therapy even really checks your levels before they start. How many of you have ever been into your office and you're having hot flashes and you're postmenopausal and they just say, here's your prescription, right? They don't even check blood. They don't check blood levels. They just give you your Vivel or your whatever, the flavor of the day, whatever the rep has pushed that week, right? So that's the first thing. The second thing is because they last 4 to 6 months, you're balanced 24/7. There's no roller coaster effect. That's the second best thing about pellet therapy. The third best thing about pellet therapy is it has been around since the 30s. It's not new. It was being widely studied in 1930s and 40s in women who had had radical hysterectomies, meaning they had their uterus and their ovaries removed. What they found in the 40s, that's when we discovered women actually made testosterone. And when they added testosterone to the estrogen therapy in the pellets, women felt so much better. But does anybody know what happened? I always love to get these, see what comes out of this. But in the 40s, when the pellets kind of fell by the wayside, anybody know what happened in the 40s? What came on market in the 40s? Anybody? Premarin, right. So Premarin came on market in the 40s, and it was being advertised in Sears and Roebuck and all over, you know, the big Sears and Roebuck old magazines, you know, with the washing machine. So, and it was really touted to save lives, and it did. And so it became the greatest thing since sliced bread, and it was for many, many women until decades later when we realized it wasn't such a great thing. But Europe and Australia, primarily Australia, still to this day it's their primary hormone therapy, but Europe continued to research and develop pellets, and that's where the majority of our studies come from. And this kind of moves me into the next portion of what I want to talk about, and that's the studies, because often people come to these talks or these events or into our offices and say, well, I talked to my doctor about this, my regular doctor, and he or she says there's no evidence behind this, it's just hogwash, it's investigational, we don't know anything about pellets, blah, blah, blah. Well, that's just because they're misinformed. There are literally thousands of pellet studies out there available. We have them for our practitioners available in a database on a specific website for them, so they are there. But the biggest thing I think most women fear when you talk about hormones is what? Yeah, the answer is right there, so it's pretty easy. Breast cancer. So when we hear about hormones, our biggest fear, number one, is breast cancer. The majority of the literature with regards to breast cancer and pellets is talking and showing how protective testosterone is to the breast. Testosterone decreases estrogen saturation of the receptors in the breast tissue. In other words, the receptors in the breast tissue have an affinity for, meaning they like testosterone better. But if there's no testosterone around, estrogen gets those. And it's that estrogen, specifically the bad estrogen, the 16-dihydroxyestrone, stimulates that breast tissue. So what we find is when we get testosterone levels up, and most importantly, prevent by getting testosterone levels up in the 30s and 40s, we can greatly decrease breast cancer risk. Now, testosterone doesn't reverse breast cancers. It's not going to cure breast cancers. It's simply preventative. And moreover, one of the biggest studies that we found to date was the nurses' health study, and 120,000 nurses that were already on those conjugated estrogens that I talked about earlier that are made from horse urine, have a very high risk of breast cancer. 120,000 nurses were already on those, so we already know their breast cancer risk is going to be high, 20 to 35%. When they added natural testosterone to their therapy, they had 0 breast cancer increases, 0, none. It's the biggest study to date that shows us that testosterone is highly breast protective, even in women on synthetic oral estrogens. But I do want to dispel one thing. I want to make sure you're aware, and continuing this dispelling the myths and separating out natural from synthetic. When all of these studies were coming across from the other countries how protective testosterone was, we had a great idea in this country to create a synthetic oral testosterone estrogen combo and tout it to protect the breasts. And it sailed through FDA trials because they were using natural testosterone studies to prove that their synthetic testosterone was going to deliver the same results. So came on market, was great. Estrotest, Sedentest, you might have heard of these. And what we found about 3 or 4 years later is these drugs actually increased breast cancer risk. Why? Because when you take oral testosterone, oral synthetic methyl testosterone, it converts to estrogen in the liver. So these women that felt or thought they were protecting themselves were actually increasing their risk of breast cancer. And those drugs are still on market today, still prescribed. So a little food for thought, not all hormones are created equal. When I tell you testosterone is breast protective, that doesn't mean synthetic oral methyl testosterone is breast protective. That means natural, non-oral testosterone, okay? So that is that study, Women's Health Initiative Trial. There are literally hundreds of studies for breast cancer, hundreds. And I used to belabor this point in my talks, and I could see that people going, okay, we get it, we get it. So I'll synopsis it here. Testosterone delivered by pellets does not increase the risk of breast cancer, unlike oral synthetic. I think I said that a lot. Testosterone implants have shown less stimulation of breast tissue. And when you treat with testosterone and estrogen, breast cancer risk does not go up, even in breast cancer survivors. And we have hundreds of breast cancer survivors on our pellet therapy. Now, we typically just give them testosterone only. And it's not really because we think our estrogen is going to cause a breast cancer. It's just not standard of care. You wouldn't give an estrogen receptor positive woman that has a history of breast cancer typically estrogen. The exception to the rule, we have a few that are 10, 15, 20-year-out survivors that are miserable and want the estrogen, and we have them sign a breast cancer waiver and they get their estrogen. And so far, in the handful of patients in my practice, that we have no problem. But by and large, the testosterone is going to give breast cancer survivors a good 90% of their symptom relief. And there's some oncologists out there that get it and are very big proponents of patients receiving testosterone therapy. I just got an email from a patient that she was diagnosed this summer. I was really sad. It just makes me so sad. She's the 5th patient of mine in over 5,000 patients. That is not even statistically significant. If you look at the numbers, 1 in 7 women now, it used to be 1 in 23 before we took iodine away from our food. but 1 in 7 women will get breast cancer. So for me, 1 in 1,000 is a big difference. And what we know about breast cancers is it typically takes about 8 to 9 years for them to grow to a size that it's detectable. So it usually are pretty slow growing. So typically in our practices, if we get a breast cancer diagnosis, it's been brewing for a while. It's been brewing for a while. And it doesn't mean that the estrogen we gave them wasn't making things worse. It might have been, but it's not causing it, is my point. There is no study, in fact, there are many studies that show natural estradiol via pellets does not increase breast cancer risk. Dr. Gino Tutera, who I trained under, did a study in his same numbers as I. He had 1 breast cancer in 1,000 patients that he followed over 25 years. And she was actually diagnosed within 2 months of receiving pellets. So really, she kind of didn't count, but they put her in there because, you know, she was one of the trials patients. So we really see very, very low breast cancer rates, if any, very low with pellet therapy. So it's very safe when if you have family or friends or, you know, ever hear this question, testosterone. Again, there are many oncologists, they're pro, they get it. Some oncologists will tell their patients, no, you can't even take testosterone because it'll convert some to estrogen in the liver, stay away from it. I really feel sad for those patients because their oncologists just aren't educated, but there are some that get it. And moreover, most breast cancer survivors are on what? Estrogen blockers, right? Tamoxifen, all these things. So, you know, if you're going to get even a little percentage of estrogen conversion from testosterone, you're on the estrogen blocker anyway. So it kind of doesn't really make a lot of sense to me. And, you know, Angela Reed, who's Chris Reed's wife, she's a breast cancer survivor. Her oncologist, very pro testosterone pellet therapy. It has actually saved her life and, you know, relationship and so forth. So moving on, because I know you get the point and I'm belaboring it here. Osteoporosis is a big killer in this country. I can't remember the statistics. I think it's a woman dies every 8 minutes from complications of osteoporosis in this country. Usually it's pneumonia or, you know, blood clot or something. It's not the break necessarily, but a complication of it. And what we found is testosterone. Now this study has been done twice by Stud. The results were the same both times, is testosterone increases bone density by over 8% per year. That is more than anything. Fosamax, Boniva, you know, which also now we're finding doesn't even really increase bone density. The numbers look better on paper, but it's very brittle bone that still breaks. We have not decreased osteoporosis or fractures in this country since those drugs have been on market for the last decade. Moreover, they make you throw up your toenails and you just feel horrible, and esophageal cancer and all these other side effects. It's just not worth the risk. We get all of our patients off of those drugs. And I have seen now more than I used to keep track of how many osteoporosis and osteopenia we reverse in our practice. We don't even do that anymore, but because there's so many. But probably the biggest one that sticks out in my mind is a nurse practitioner, a patient of mine who she had not had a normal bone density since 1994. And she got it last year, 2 years after being on pellets. It's her first normal bone density scan since 1994. And she's done everything. So that's probably the biggest one that I saw a big reversal. I've seen up to 10% in one of my patients in her pelvic bones from reversal of bone density, increase in bone density. So it really is profound for osteoporosis and osteopenia, prevention and reversal. Alzheimer's disease is another one that is really, the studies are pretty impressive. Men with low testosterone are 3 times more likely to develop Alzheimer's disease, okay? Men that have their testosterone levels restored to those optimal levels that I talked about have a 70% reduction in Alzheimer's disease risk. Women have a 50% reduction. So very protective to the brain. There's thousands of receptors for testosterone in the areas of our brain that's responsible for mood and thinking and mental clarity and focus, the parietal and temporal lobes. And as testosterone levels decline, this is a theory, and those receptors are not being saturated. It's kind of like if you don't use it, you lose it. So we're seeing big correlations to testosterone in prevention. It does not reverse. I have had a couple of patients in my office that their family members have brought them in to try the therapy to see if it would halt progression or worsen or reverse, the Alzheimer's or the dementia that they're experiencing. It does not. So we are, once, you know, those neurons and those cells are dead, they're dead. But big for prevention.
But it doesn't halt?
It can slow down that progression, but it does not stop or reverse. that we've seen with regards to hormones. Heart and cholesterol, great studies are coming out over the past few years. Of course, men over 55 or who are being studied, but we're seeing not only decrease in coronary artery disease risk, but reversals in plaques in the coronaries with testosterone therapy. It's pretty awesome. Testosterone is a natural coronary artery vasodilator, and we're seeing, and it's a powerful anti-inflammatory, which is coronary artery disease. I know in this country we have this misconception that that is a disease of too much fried chicken, and it's not a disease of too much fried chicken, although that doesn't help. It is not a disease of too much cholesterol. Stopping cholesterol production in an otherwise healthy person who's fit, doesn't smoke, is really bad for them. Cholesterol is the building block of all hormones in our body. So again, we jump on this stopping, prescribing statins, which cause all kinds of muscle breakdown and kidney failure and all kinds of liver enzymes increase, all these side effects. When it's just automatic. Oh, see a high cholesterol, let's put them on statin. Well, let's kind of tease out maybe why. You've got this fit guy, Chris. If you came to me with testosterone, you're fit. You have no reason. You eat healthy. You drink raw juice, right? So why is your cholesterol high? Maybe that's your normal. The coolest thing now is the technology that they can actually look and see plaques and calcifications on your coronaries and make a decision from there. Do you need to be on statins? Which I think makes more sense than just looking at cholesterol level. Maybe there's a reason your cholesterol is high, because cholesterol is the building block of testosterone. So what we're seeing with testosterone therapy long term is cholesterol levels coming down, LDL levels coming down, HDL levels going up, in women fat mass decreasing, lean body muscle increasing. So just being patient, giving it some time, rather than jumping on the statin train, is really a more effective approach. Now there are patients that need statins. I don't want to again sit here and be anti-medication, lifelong diabetics and poorly controlled diabetics, high-risk heart attack patients, their dad died at 40 and their uncle died at 45 and blah blah blah. Okay, there's some cause for maybe some prevention with medications there, but by and large it's overprescribed, just like Concerta is overprescribed, Prozac's overprescribed, Xanax is overprescribed, really looking at, again, root cause. So heart and cholesterol, very preventative. No studies on women, of course. We don't really ever look at women with heart disease. I don't know why, but it's kind of sad. But you can assume the same holds true, because testosterone is going to work the same in a woman as it does in a man. There's some really great studies out there showing that testosterone and estrogen stimulates, they're called progenitor cells in the joints, and basically they're pre-cartilage cells. So again, now rheumatoid arthritis is an autoimmune inflammatory disease. So hormones don't really have an effect on that, although other things do, like vitamin D and other things to prevent for autoimmune. But osteoarthritis is going to be the 4th leading cause of disability by 2020. And what we're finding is prevention of osteoarthritis with natural hormone therapy, testosterone and estrogen, is very, very effective. Joint pain is one of the top symptoms in my patients, and many of them that returns when their pellets wear off. They get achy and their joints start aching again. So it's very profound. Again, it's that anti-inflammatory portion. Testosterone is a powerful lubricator all over the body. So that synovial fluid that lubricates the joints, it stands to reason testosterone increases that or decreases the viscosity, meaning it's not as thick, so it's able to move through the joints better. I have patients that say their eye lubrication is better when they have their pellets peaking. So this dry eye thing that they're constantly having to put lubricating drops, they don't have to. Vaginal lubrication is a big problem for a lot of women. Testosterone increases lubrication all over the body, so it's another player with the joint pain. So, lots of information, right? Lots of information. So the key take-homes really are hormone imbalance can occur at any age. My youngest patient now is 19. My oldest is in his 90s. And so there is no age parameter. If you're symptomatic or you have family that's symptomatic, get tested. And when you get tested, make sure you see somebody that understands how to interpret those labs, because you don't want to be told, like many other people that get tested, that you're normal. So I wish I had a lab slip here to demonstrate for you that on the right side of the lab slip is a reference range. It doesn't say normal range, it says reference range. So this is what the lab expects everybody from 2 to 92 to fall into. And it's not optimal. So normal is not optimal. I have so many patients that come in and say, I got my blood tested, my doctor said I'm normal. Really? Because your testosterone is 201. That's not normal. Because if it was 199, then you would be low, right? Come on. So it's kind of silly. So pay attention to how you feel. Find somebody that knows, you know, how to interpret the labs. Looking at vitamin D and thyroid and iodine is so important, and I don't have time to really get into that today, but we train our practitioners to really look very closely at vitamin D, thyroid optimization. Iodine is so important now. We're seeing it's always been important, but it's kind of really made a resurgence. So get tested, find a hormone expert. It's not a one-size-fits-all approach. We don't have just one dose for everybody. It's not cookie cutter dosing. I need something different than you and you and you and you and you. And so it's very important to be dosed to you. And of course, when patients are balanced, this is what they say. I feel great. You gave me my life back. I mean, there are just testimonials, story after story after story after story. I think the most recent data is showing 93% of our patients return for their hormone pellet therapy. That's the largest rate of return of any hormone therapy out there, and it's because it works. And people feel good and they feel optimal, their relationships are better, they're more productive at work, they're getting more done, and their abundance in life is greatly, greatly increased. So, question time. So this is a good question, and it's probably, I get it obviously at every seminar I do. The question of how much does it cost, does insurance pay for it? So I'm going to cover those questions really briefly. On average for women, the pellets are anywhere from $300 to $350 depending on the practitioner in your area that you find. On average $325 to $330. And they get them about every 4 to 5 months. So it kind of breaks down to $60 to $80 a month, which breaks down to about $2 a day, which how many of us spend about 5 to 10 on Starbucks? Yep, okay. So when you break it down to a daily thing, it's really pennies, really. Insurance, and for men, anywhere between $700 and $750, depending on the dose, because higher doses over 2,000 milligrams for males, it bumps up to $700 to $725. And of course, the practitioner in your area. On average, though, that's the average price that practitioners are charging. Men last about 5 to 6 months. So again, about the same rules apply. It's about $100 a month. If you break it down over a 12-month period, and then you can do the math on the monthly. Daily price. But what is great, and compared to when I started doing this 4 or 5 years ago, insurance is reimbursing so beautifully now. And we have great detailed paperwork that we give our patients to file for insurance that has the proper coding. We code it as a procedure, not hormone therapy, and we have the right diagnosis codes and all of the literature and a letter of medical necessity. We've pretty much figured out everything the insurance company will kick it back for. Men get reimbursed at a greater rate than women because guys need testosterone way more than we need hormones, really. But anyway, men are making those decisions. But they do get reimbursed more at 100% rate. Women are getting anywhere between 30 and 100% on their reimbursement, depending on their insurance company. The bigger, larger group insurance companies, many insurance companies are really pro getting into this prevention and preventative wellness thing and reimbursing. So I'm seeing insurance reimburse at a much higher rate than I did 4 or 5 years ago. Lab insurance, the majority of all insurance companies will cover the labs. So most all of the practices will take insurance for the labs and take insurance for your initial office visit, where you can just pay a copay for the consultation, but you will have to pay the pellets out of pocket. HSA flex cards are a great way to do it because you can put money aside and just use it, and they pay all the time. I've never had any of those denied. And you know, it's hard to, the other thing BioTe has that's really wonderful now is patient financing. And it's a great program where patients can get their pellets and finance a year's worth, if you will. There's different levels. I think, you know, there's like what, 900, 1200, 14, something like that. And they can pay it out monthly over time. So it's another great option for patients that don't have the cash up front, because that is a lot of money to put down up front. So that's the money, that's the insurance. What else?
If I'm on some type of hormone already, I mean, how does that work?
So you don't have to go off your, that's a great question, off of your current therapy to be tested. Our practitioners understand very, very well how to interpret the labs, even if you are on estrogen or testosterone or a patch or whatever. Most guys that are on other forms of testosterone therapy have a baseline testosterone that they've been tested. Most doctors will use labs that are 6 months or less old. They're older than 6 months. We typically like to get a whole fresh new set of labs. Guys absolutely have to have a PSA level before they start this therapy. No, do not pass go. You have to have a PSA, even if you're 35. So we'll take old labs, but you don't need to stop your current regime. A lot of women think they have to go off their estrogen, you know, whatever they're on before they get tested, and they just don't need to do that. It's a good question.
If I have an adverse reaction to the pellets, can they be removed?
We do not and have not had to remove pellets in, I think Dr. Donovitz, have I calculated, we've done over 25,000 procedures together. And we don't remove them. We just don't have reactions and response that require that. The side effects, if any, are very minimal, and they are reversible. So we have not been in a position to where we have, even in women, we've had women that get pregnant on the pellets. We don't remove them because, again, if you realize you're just bringing them to an optimal level, you know, there's no reason to remove them. Moreover, the pellets just have pure natural plant-based testosterone or estradiol, so there's nothing to have an allergic reaction to. We've not had any record in 40 years of allergic reactions to the pellets ever. Itching, sensitivity around the site sometimes initially as the pellet is absorbing, but that's not an allergy. That's pretty rare. Side effects. Probably the #1 side effect that women get annoyed with is our hair grows faster, okay? So testosterone increases the rate of hair growth in men and women, whether it's on your head or anywhere on your body. So that's probably the biggest nuisance side effect. Manageable, dropping the doses down manages that, but most women feel so good. They don't care. Like, I'll wax, I'll thread, I'll laser, whatever. So that's really not an issue. Sometimes in the initial dose of pellets, when you're going from, for women, now I rarely see stuff in guys, but for women, going from, you know, no testosterone to blasting them, you know, they go up over 4 weeks kind of to about 200 or whatever. Some women that are prone to breakouts can have an initial breakout as their hormones get balanced. It's not horrid. It's not typical in subsequent rounds. If they do have issues with acne in subsequent rounds, we adjust the dose. So every side effect that we see is manageable. The other big side effect that we deal with, it's probably the one that I hate dealing with the most, is bleeding in women that have a uterus and are getting estrogen. The majority of the time that happens, it's because they have been non-compliant with their progesterone. Women with a uterus that are getting estrogen therapy, whether it's pellets, patches, orals, or whatever, have to have progesterone to protect the uterine lining. Progesterone keeps estrogen from building up the uterine lining, so it keeps everything steady. So with our therapy, how we dose, low dose estrogen, low dose progesterone keeps everything nice. Now, two things can happen. Either women will forget a pill or 2 pills, or their pharmacy has taken upon themselves to switch them from brand to generic. And because generic has a 30% efficacy leeway, they bleed because it's almost like skipping a dose. So those are the things that we have to work through with women with bleeding. It's not often, but it does happen. Again, it's reversible. Sometimes bleeding in a postmenopausal woman when there's no reason and they haven't skipped any estrogen, you know, they haven't skipped any progesterone and their estrogen levels are not high, is a little bit of a warning sign that something's brewing there. You need to get it checked out. We've detected a lot of early cancers by that symptom of bleeding, because a uterine cancer can be just sitting there hanging out. It's going to grow and it's growing slow, but when you get estrogen and it stimulates that and it blossoms and gives us attention and says, hey, I'm here, that's a really good reason to send a patient for a workup. So when we get patients that are bleeding and they shouldn't be, that's a good reason for a workup. And I've found several dormant or not yet blossomed or metastasized uterine cancers that way. So it can be an actual blessing in a lot of patients to get that information early. So those are kind of the most common side effects for guys. Not really, the biggest side effect that guys can have with any testosterone therapy is the overconversion of their testosterone to estrogen. And that is one reason why it's so important to get those post labs. And all I have to do to my male, guys aren't very compliant, right? I mean, they don't really kind of do, usually you guys don't really do what we tell you to do. But all I have to do in my consultations is say, now it's really important for you to get these labs in 4 weeks, because not only am I checking make sure your testosterone got really well, around 1,000, but I want to make sure your estrogen didn't go up, because if your estrogen goes up, you're going to be crying on insurance commercials and you're going to grow boobs. And they're like, oh, I'm going. I'm going. Usually that sticks in their mind that it's important. And if that does happen and their estrogen's too high, very simple fix. They go on an estrogen blocker prescription. It's easy. A lot of guys aromatize their testosterone to estrogen. They have more of an enzyme called aromatase that causes that to happen. And it's easy to manage. The other very rare side effect in men, which is why it's important to get those labs, is some men can increase their red blood cell production with testosterone therapy. It's called polycythemia. It's very rare. In the thousands of guys I probably have less than 10 that have this phenomenon, but they basically are making too many red blood cells and they have to donate blood. So those are the two side effects in guys. But again, nothing that is anything we've ever had to remove pellets for. So long answer to your question, but it led me into some good information. Thank you. Good question. Yep.
My wife had breast cancer 18 months ago. Is she eligible for pellet therapy at this point, or does she have to wait a certain amount?
Well, 18 months into, depending on what regime, yeah. So she would be a great candidate to get her blood tested, obviously for testosterone only. And then, of course, just educating her about, she really needs to just educate herself to be armed with information for when she follows up with her oncologist and they say, no. But that's early in the relationship with the oncologist. And although I know the information and the data to be true, that it'd be very beneficial for her, that conversation, is going to have to happen with her oncologist. She's probably going to want the oncologist's blessing. But what I tell patients is get all the information and you make a decision. It's your body as to what is going to be best for you. But in my opinion, she's a great candidate for testosterone therapy. Iodine, for sure. It's a huge relief between low iodine and breast cancer, and iodine can be very preventative for breast cancer. So lots of things that we could help her with. So, any other questions? Those are all good questions. I think we're going to wrap it up now. All right. Thanks a lot, guys. Have a good day.